Well, good morning, everyone. This is Garth Reynolds, your Executive Director. I'm sitting here at the Sangamon County Public Health Department, and I have just received my second dose of the COVID vaccine. And I hope most of you are in the same situation, either waiting to receive your second dose or have received your second dose. If you haven't, please do consider getting the COVID vaccine. This is something that we have talked about from IPHA for a number of years, that we have to step up and be a great example for not only our patients, but for our communities, and now even our peers, that we have to be fully vaccinated, not only to protect ourselves, but our friends, our family, and our patients. So I just wanted to sit here and just kind of share some of my thoughts this morning as I am looking at this great operation that Sangamon County Public Health has put together here. And I'm looking forward to more and more pharmacies being able to vaccinate in the coming days, weeks, and months. Because one thing we have to realize, this is not going to be a quick and done endeavor. This is the largest medical mission in humanity. And I'm proud that you and I and all of us in pharmacy are part of it. And it is frustrating because we've had a slower rollout than we would like. We definitely have not had pharmacies at a ready status that we would prefer. But we are continuing to advocate hard with the Department of Public Health. And I'm really impressed upon the diligence and the innovation of you. I have seen more extraordinary endeavors coming from our members since this pandemic started last March. And whether it was finding new ways to still deliver care and protect your practice and keep it open, to deliver medications, to make sure that you're preparing for the vaccine. You have done it. You have stepped up. And on behalf of your patients, I want to say thank you. And on behalf of your communities, I want to say thank you. Because it's going to take all of us to get ready for the rest of this vaccine effort. We're entering phase 1B. I will still say we're technically still in phase 1A, because until it's complete, you can't move on to the next phase. And we have a significant number of patients in Illinois to be able to immunize. So we have to get ready. And I'm proud today for IPHA to endeavor on its very first pharmacy technician training program, utilizing the IPHA and Washington State University program. We've worked real hard over the last couple of years expanding the training and recognition of our technicians who sacrifice and help us and leap over all barriers to make sure that we can take care of our patients every day. And for that, we're grateful and thankful. But this is an interesting new day for pharmacy. And I think this will show and be looked back upon as probably some of our best days in our profession. It's been a rough couple days and weeks trying to get this vaccine rollout started. And as always, if people would listen to pharmacy, it would be running a lot better. And we're continuing to advocate, and we'll continue to be here for you. And I'm glad and honored to be able to be your executive director. I think it's really great that we'll be able to help get not only just Illinois, but our country back on its feet. So again, these are just some of my thoughts today. And I really encourage all of you, if you haven't taken your vaccine, to please schedule that today. Work with your local health departments to volunteer. Work with your county health departments to make sure that they know that you're ready to receive vaccine. And do everything we can to engage our patients. That's going to be our biggest challenge, I think, is getting our patients communicating of when they can receive and where they can receive the vaccine, and helping them on the dose management. And and of course, just being there to help them and educate them as we do each and every day. So again, thank you very much, and I just want to let you go and say thank you again for all of your service, and thank you for being a member of IPHA.